And now we're down to the final stretch with professional caring and ethical practice. This is the last section of the CCRN review. However, it's very important. So it's a good idea to go over those materials that are in your handout and to do all of those questions in the professional caring and ethical practice section. And let's talk about some of these concepts a little bit, so that you will hopefully have a better idea as to how AACN defines them and how they use them, especially on the exam. So AACN has broken down both our patient characteristics and the nurse characteristics into 8 different characteristics. So what they want to do is they want to describe in more detail some of the components, some of the pieces that are going to involve or that are going to affect both our patients and our nurses. So let's take a look at the patient characteristics first and talk about what this means. Now, obviously, you probably have a definition of all of these things in your head, but let's talk about what AACN says about each one of these characteristics. So first of all, resiliency. This is the patient's ability to be able to bounce back, to be able to come back from whatever it is that they have. Your patient in your ICU, very sick patient. Okay, multiple medical problems, etc. going on. How resilient is that patient? Some patients may be able to bounce back from even the worst condition, and others don't. So we see that all the time with sepsis. Some people will bounce back very easily. Some go into multi-organ failure and die as a result of sepsis. And that has a lot to do with resiliency. Resiliency does not always follow someone's age. So in other words, we may have an older patient, maybe even somebody in their 80s, who comes into our ICU and they're very resilient. So they have a good solid immune system, they're very active and healthy, and they may be able to bounce back very easily from even a very severe disease. Vulnerability. So our patients who are immune suppressed, etc., those are going to be patients who are vulnerable, patients with diabetes, etc. So not only those conditions, okay, we're looking at the medical end of this, right? But also if we look at the psychosocial end of this a little bit too, our patients who are homeless, our patients who maybe have difficulty with their job or money or their health insurance. All of those considerations play into this vulnerability. Stability. Stability primarily refers to the hemodynamic part. Okay, so, when we're looking at a lot of our patients in the ICU, what we're paying attention to is the hemodynamic part and the physical part, and that's just all contained right there. So we're not really considering a lot of these other components unless we really start thinking about it. Okay, well, the next one is complexity. How complex is that patient? And that, again, has multiple dimensions. It's not just how complex is that medical problem, but also how complex is their family situation, their living situation, maybe their ability to be able to recover from this illness. Most of our patients are not going to jump out of the ICU and go back to normal life. They're going to, come out of the ICU and they're going to have to do physical therapy, or maybe they have a prolonged stay in a less acute area, but there's going to be some additional complexity to that. So when we're talking about complexity, it goes beyond just the physical part and the pathophysiology. Resource availability. What resources does that patient have available to them? And in some cases, maybe the patient has lots of resources available to them. We assume that with children, that they're going to have their parents as resources. Now, that's not always the case, of course, but that's what we're going to assume. So we make an assumption about that. Participation in care. So how well is that patient able to participate, and how much do they want to participate in their care? If the patient's going to be going home, obviously we want them to take more of an active role in their care, but some patients don't have an interest really in participating in their care, and so we need to possibly work with that patient a little bit more so that we can show them how important it is that they are participating in their care. Participation in decision making. When we ask patients about decisions, we consider that the patient is not just that person laying in the bed in front of us, but also that patient's family or other resources that they have. So they may have other resources that they're relying on, friends, etc., that will help them with their decision-making process and want to be involved. So the participation in decision-making may go beyond just the patient and the caregiver, and it may extend out to their family or who the people they consider to be family. And we want to involve them in the process of care for the patient and the process of decision-making. Predictability. How predictable is that patient's course? And again, that's going to have multiple different characteristics or multiple different things that are affecting it. We can say that the course is fairly predictable for most patients who have this particular disease, but that doesn't necessarily mean our patient is going to have that level of predictability. So when we're looking at each one of these different components, think about them in relationship with that specific patient and not just that global definition that we may have learned at some point in time, but apply this directly to the patient. So as you're going through and you're going to work in the next couple weeks, start thinking about some of these concepts and see how they fit with some of the patients you're caring for. Does this patient have a particular level of vulnerability that you haven't seen before? Is there a need for additional participation in care or decision making with this patient and the patient's family? So think about some of those things as you go through. It's going to make these questions a whole lot easier when you get to them on the exam. In addition to the patient characteristics, there's also the nurse characteristics. So there's 8 characteristics the AACN says that we need to be aware of with the nurse. And these are kind of things that they're saying that you need to be working on. So if this isn't already part of your practice, then we need to include this as part of your practice. So as you think about your typical day taking care of patients, you're probably very in tune with the caring practices. So the caring practice seems like that's probably pretty close to your heart. That's what we do every day, right? A couple of the other ones, though, that probably need a little bit more explanation. Collaboration. Okay, so we may say, well, yeah, we collaborate. I mean, we've got other people coming in on the floor all the time, and, we've got medicine, we've got dietary, et cetera. We've got all these people coming in and taking care of the patient. But in many cases, that's done in a very haphazard way, and there isn't a whole lot of coordination between each of these different services. Now, the only thing that is consistent in most of our patients, and you all know this, the only thing that's consistent is going to be the nurse. So we're there all day. Meanwhile, one doctor comes in, sees a patient, another doctor comes in, sees a patient, dietary comes in, physical therapy comes in. All of these different people are coming in and looking at the patient, and they're generally not talking to each other. They're maybe talking to us, but we have to be the consistent one that is passing along messages and passing along the treatment plan, etc. So when we're talking about collaboration, we really need to be working on trying to not only kind of vet all this information that's coming to us, but also to try to bring these other services together so that we have one plan and one idea for how we're taking care of the patient. Systems thinking. Okay, so you may say, geez, a lot of these things are real nice, Dave, but our hospital can't do that, or our hospital won't do that. Okay, and the AACN says if you've got things that are missing, if there's policies that are outdated, if there's procedures you're doing or ways you're managing patients that aren't helpful, that aren't in the patient's best interest, and that don't meet these characteristics, that you are going to find a way to navigate the system to change it. So that's what systems thinking is talking about, is navigating the system to be able to change it so that we are meeting the needs of the patient. Advocacy and moral agency. speaks to the fact that we should be the patient advocate. And if that patient, we find that that patient maybe is not getting a type of service that they should have, maybe you went to a conference and you found out about this new treatment or something we could be doing with our patients and the physicians won't order it. Well, we should be that patient advocate. And we should try to get our policies changed so that the next patient will have access to that treatment. Clinical judgment. So again, this is another one of those pieces that you probably do every day, but it's expected that we're going to have a good clinical judgment. And that's what a lot of the exam is testing, is your clinical judgment. And they're going to give you some scenarios. Some of the questions are just going to be straight up multiple choice questions, and some will be scenarios. Response to diversity. We're not talking about the diversity in different people here as much as we're talking about diversity in patient presentation, diversity in the way that you're caring for patients. So there's going to be a lot of diversity that is involved when you're talking about caring for patients. Maybe you learned about the novice to expert framework at one point in time in your career. And Pat Benner says that we move from novice into advanced beginner, competent, expert, etc., as we go through our careers. Well, the novice uses very concrete thinking, and there's just one way to be able to do something. Unfortunately, what happens in some cases is that people get stuck there. There's one way to do this. This is the way I learned it here. This is our policy. Whatever you want to say that goes along with that. A lot of times that's what we learned, and we stick with it. I remember working with a nurse a few years ago, and she would always say, that's not the way it's done here, or this is how we do it here. Now, she went to a diploma school in that hospital and had spent her whole career in that one hospital, and that was all she knew. So there wasn't any diversity in her approach to patients. In her approach to patients, it was always the same thing, because that's how she learned it. Well, we all know that we're going to pick up on bits of information, and we're going to pick up on best practices from all over the place. There's tiny little hospitals all over the country that are coming up with great innovations in how to care for patients. There's also big hospital systems and those big teaching hospitals that are coming up with great innovations. But we want to take all of that stuff back and have a diversity in the way that we manage patients that best suits their needs. Facilitation of learning. Primarily, we're talking about here teaching our patients, but patients' families, but we want to have that facilitation, and we want to make sure that we're doing that well. This is another area that a lot of times nurses struggle with. We were never taught how to teach, and suddenly we're having to teach patients, and so, we give them an instruction sheet and say, well, this is what you're supposed to do, take this 3 times a day, whatever the case may be, and patient goes home, and they forget all about what you told them. Okay, when you were telling them their discharge instructions, what do you think they were thinking about? Their brain wasn't sitting there concentrating on those discharge instructions. They're thinking about getting home. They're thinking about getting out of there, right? So their brain isn't where, it should be to try and comprehend something they have no idea about, right? So, we're talking to them, and a lot of times it seems like we're talking to them in a foreign language because it's not something they deal with on a regular basis. So we want to be careful in the way that we're presenting this, making sure that the patient has multiple ways to be able to get a hold of resources if they have questions after they leave. Same thing is true for our patients' families. Even if the patient is not leaving and we're not doing discharge instructions for our patient, if the family is going home or the family is going out to the waiting room or whatever, we want to make sure that we're giving them good instructions and we're teaching them about what's happening with the patient so that they feel informed and they feel like they understand where the patient is at and how to get a hold of us if they have questions. And then clinical inquiry. Okay, you guys are the ones at the bedside. You guys are the ones asking questions. This is where clinical inquiry begins. So if you say, hey, look, I don't have anything to do with research, man. I do not like research. I'm not going there. But you guys are asking the questions. That's where research starts. Research starts at the bedside. And if we don't have people out there asking questions and saying, hey, isn't there a better way to do this? Or why are we doing it this way? Or, maybe it's, hey, I noticed this same thing with all my patients when I do this. Why do all of Dr. Smith's patients die? Just kidding. But we're asking questions at the bedside. And those questions are going to lead to research or an evidence-based practice project and improvements in patient care. So that's why the AACN says that clinical inquiry is one of the nurse characteristics, is that we're asking those questions so that nursing professional practice improves and continues to improve over time. Okay, some last-minute exam pointers. I want to reiterate that cramming does not work. Cramming is not going to be a good way to do this. I have talked to people who have tried to cram. So they've said, hey, you know what, I'm going to sign up for my exam on Friday. I'll study all day Thursday, and then I'll go take the exam. Okay, that's not a good way to make this happen. Not only that, but you're shortchanging yourself. If you're cramming at the last minute before the exam, basically you're trying to memorize a bunch of stuff and do a brain dump on the exam, and you never had a chance to learn it. So what we want to do is we want to take this stuff in, take it back to work. Think about it while you're at work. Hopefully you can implement some of these things while you're at work. Relax on the exam day. It's going to be hard, okay, because you're probably going to be nervous about taking the exam. There's a number of reasons why we might be nervous, but we want to try and relax as much as you can. Hey, this is an exam. This is not life and death. You deal with life and death situations every day at work. This isn't the same thing. It's just an exam. Develop your strategy for analyzing questions. Everybody's going to have a little bit different strategy. So as you're going through and practicing these practice questions, think about how you want to develop your strategy, because your strategy may be different than somebody else's, and it may work for you. If your strategy isn't working, if you're struggling with analyzing questions and you're struggling with some of these quizzes, then change your strategy. Try a different one. Take your time. Some last-minute questions. Well, feel free to use the online resources. Of course, we've got the discussion and the comments on every page. You can also email me. My email address is there, dww@thenursingprof.com, or you can call us and you can talk to one of our facilitators of the program, and they're all CCRN certified. So you can make sure that you're talking to somebody who has actually done the program too. Thank you for attending the CCRN review. Again, you can do this. If you're feeling like you've still got questions, go through the content again. You can go through this over and over again. Use the quizzes over and over again. Go and use our Quizlet to do additional questions. Practice, practice, practice your questions. And again, reach out with any questions. Thanks again for joining me for CCRN Review. Until next time. Bye.